knock on the door, wash my hands. Hi, I'm Maya. I'm going to be your student nurse today. I just want to know if I could do a physical assessment on you. Okay, thank you. Okay. Can you let me know what your name is and date of birth? Okay, that's correct. Do you know what month it is today? Do you know where you're at? Do you know why you're here? Good. Okay, so what we're gonna do is we're gonna go ahead and we're gonna check your eyes. We're gonna check eyes bilaterally. We're gonna look for Perla. His eyes are, pupils are equal, round, reactive to light, and accommodating. Okay, can you follow my pen? Good. Now we're gonna go ahead and we're gonna assess your mouth. Checking all your teeth, your uvula, your throat, your tongue. Making sure everything in there is nice and pink and moist. Now we're gonna go ahead and we're gonna check your ears bilaterally. We're looking to see how the skin is, any drainage, and we're gonna check the tragus for any pain. Okay, have you been experiencing any swallowing issues, headaches, earaches, any dizziness? No? Okay. So now we're gonna go ahead and we're gonna assess your heart and your lung sounds. I'm just gonna pull this down. So we're gonna start with the aortic, which is the second intercostal on the right sternal border. Then we're gonna go over to the pulmonic on the second intercostal of the left sternal border. Then we're gonna go down to the third intercostal, which is Erb's point. Then we're gonna go to the fourth, which is the tricuspid. And we're gonna go to the fifth intercostal mitral valve, apical pulse. Okay, now we're gonna go ahead and assess for your lung sounds. We're gonna start on the right upper side and we're gonna use the ladder technique to go across and I'm gonna listen laterally and posteriorly. Have you been having any chest pain, shortness of breath, or any issues with your breathing? No? Okay. All right, now we're going to check your abdomen. We're gonna start in the right lower quadrant. We're gonna go up to the left lower quadrant. The right upper quadrant, left upper quadrant, and then the left lower quadrant. Listening for at least 30 seconds each. Now we're gonna palpate right lower, right upper, left upper, left lower. Good. We're gonna go ahead and we're gonna check genitalia to see if we have any discharge, rashes, or lesions. Everything is good. No rashes or lesions or discharge noted. Have you been having any issues with constipation, diarrhea, urinary issues, any upset stomach? No? Okay. So now what we're gonna go ahead and do is we are going to check your skin integrity. We're going to assess the skin to make sure that there is no lesions, no rashes, no bruises. We're gonna check on the upper clavicle area to see skin tenting. Skin in arms is good. We're gonna go ahead and check the capillary refill on every single finger. Patient is able to refill within 3 seconds, and then we're gonna check the radial pulse on each side. Radial pulse is 80, steady with 2+ rebounding. Okay. Now we're gonna go down to your legs. We're gonna check the legs for any edema, lesions, rashes, or any issues in the skin. We're gonna check your posterior tibialis pulse and your dorsal pedialis pulse. Both are 80, steady rate, 2+ rebounding. And we're also gonna check your toes for capillary refill, and we would check every single toe for tissue perfusion. Okay, now we're going to do some range of motion and strength testing. So I want you to squeeze my hand. With both hands, I want you to pull me, and then I want you to push me. Good. On your feet, we want you to press down like it's a gas pedal. Press up against my hands. Good. Okay, now we're gonna do some range of motion. We're gonna have you go supination, pronation, flexion, extension, abduction, adduction, and circumduction. Okay, all those are within normal limits. We took your vitals. Your vitals are all within normal limits, and we're done with your assessment. Is there anything you need before I leave?